All right, welcome to the next edition of the Beyond the Blade podcast. We're here with Ali and Jasmine, and they're going to be helping us talk about the recovery process after any one of our surgeries. So this is basically a global topic. We thought it would be really important for everybody to be able to dive into. So basically, Jasmine's going to start us off with a couple of questions.
Okay, perfect. So, a lot of our patients come either from out of the city, out of town, out of state, and even out of the country to have surgery with you. They've done all their research and they've pretty much come to the decision they want to have surgery with you. And that can entail different things for clearances, since do require you to get cleared by someone in the United States. But what are your thoughts on that? Is it too tedious? Should you just forget about it and stick to your country, or should you ultimately go with you?
Yeah, great question. So we have patients not only out of city, out of state, we also have out of country. So we have patients that have come from Australia, from Barcelona, from Europe, from different areas, from Canada, and South America. So we're very blessed in our practice to have a lot of patients from a lot of different places. And so depending where you're coming from, obviously, it can get a little bit trickier, right? So if you're coming from Europe to see us, or you're coming from Canada or basically another country outside of the US, you're going to need labs that are drawn in the United States. And these are just medical legal requirements that we have to abide by the Board of Medicine in Florida to make sure that your labs are, legitimate for the United States. So if you're coming from abroad, just always try to book more time with us in Miami. You want to stay a little bit longer than the average patient. You don't want to just come for 5 to 7 days. You may want to consider a 2-week experience with us because that would be a lot better for you. You want to come in at least 4 days before the surgery to be able to see one of our primary care physicians who's going to be able to draw your labs. And we need to get all of these lab work done beforehand, and we need to get a medical clearance done before we can take you to surgery. And it has to be a U.S. doctor. Now, that doesn't mean that you shouldn't go ahead and get your own clearance in your own country, because you definitely want to be aware that you're prepared for surgery and that your primary care doctor, let's say in England, is okay with you having any type of general anesthesia and any type of plastic surgery. So that is important, but that would have to be somewhat reproduced when you come to the United States. For patients that are within the United States, but let's say they're out of Miami or out of Florida, that's kind of a little bit of a different category of patient. You can get your medical clearances done back home. Let's say you're coming to see us from Dallas, Texas. You can get all of your lab work done, your medical clearances done, your EKG, your chest x-ray, everything with your primary care doctor in Texas. And then all you need to do is fax that information to us. And we're happy to give you a list of specific lab work, specific imaging studies, and actually a document that your primary care physician can sign to basically categorize you as in low risk, moderate risk, or high risk. And depending on your medical history, we have to make a decision. So do we do surgery at our practice, or do we do surgery at the hospital? And both of those are on the table for all of our patients. I have hospital privileges in Miami at South Miami Hospital and Baptist Hospital. These are, for me, two of the premier hospitals in Miami, and they will provide phenomenal care. But you have to know that if you're going to go to the hospital, there will be a little bit more of a charge because the hospital is just a little bit more expensive. But nonetheless, you can have your surgery done, and I think you will really enjoy the experience at either of those hospitals. But that's a little bit of the out of Miami, out of state patient, but still within the continental U.S. Now, again, if you're coming from out of state, I would recommend booking at least 7 to 10 days. It's a good idea. I would say minimum 7. And there's one major risk factor if you're going to be flying into Florida, into Miami, is the blood clot discussion. Okay. So if you're going to have surgery, the American Society of Plastic Surgeons has done a tremendous amount of work to figure out what is the minimum time a patient can have surgery and then get on a plane before having a blood clot. And so the studies have shown that you don't want to get on an airplane for at least 5 days from the day of your operation. Okay. So again, I think it's safer to extend that maybe by a couple more days. And you should also consider wearing your compression stockings throughout the entire flight and then when you get off the plane. And we will be giving you anticoagulation, typically by mouth, for at least a week after surgery. All of these things combined, of course, are to help decrease DVT, or deep vein thrombosis, which can lead to blood clots and then pulmonary embolisms and a lot of other complications that we want to avoid 100%. Nowadays, actually, the little squeezing devices that we use in the operating room are now readily available on Amazon. So you can go on Amazon, and for about $60, you can buy yourself these basically leg squeezers. We call them sequential compression devices, SCDs. And you basically wrap these around your calf muscles. You turn on the machine, and it's basically giving you a massage throughout the entire flight, when you get back home, right after surgery. And so for $60, I think it's a great investment in reducing the chances of you getting a blood clot.
Definitely. I think whether you're from out of state, out of city, out of the country, whatever it is, we don't want you to rush your recovery. Sometimes we get a lot of patients that are just trying to get back home on day 5 because that is like what's safe. But we don't want you to be rushing, because the worst thing is, like, you're on day 5, you're rushing to get home, you're uncomfortable, you have drains, you're worried about a blood clot, and you're just stressing yourself out, and it's not good for your recovery. So definitely plan ahead. We do want you to have like a good recovery and to feel safe and comfortable. So don't try to rush it too much. Like, you do want to plan accordingly, so it's for your safety and for your comfort. We're doing it like for your improvement.
Exactly.
Right.
And I think the other topic that would come up with that is, if you are planning to stay in Miami for, let's say, a week, 2 weeks, what do you recommend? Where do you stay? A recovery home, a hotel with your caregiver, Airbnb?
Yeah, so for me, the way that I categorize it is, nobody's going to care about you more than a loved one. So if you can bring either a spouse, an adult child, I'm talking about over the age of 21, if you can bring a mother, a father, somebody that really cares about you and is going to be staying with you throughout the entire process, that is, for me, the best option, okay? You don't really need to have an at-home nurse necessarily. If you have somebody who's a caregiver, who's a loved one, who's not squeamish, okay? And this is very important. Like, they need to be able to see a little incision, or they need to be able to see, a little bit of blood, or a little, maybe see a drain. They have to be able to deal with some of those basic items and not pass out on you, because then we go from 1 patient to 2 patients. So, just be very careful, pick the right person. It could be your best friend from high school. It could be a college friend. It could be a cousin, whoever really, really knows you and cares about you, because that's the person that's going to be really attending to you the whole time. And that's the person that's going to be bringing you to our office for your follow-up visits and helping you get in and out of the car and showering and eating. So that's really important. For me, that's number 1. Number 2, quite honestly, would be an at-home nurse. We have a couple of services, nurses that we can contract with, that we can help you if you're staying at a nearby hotel. And we'll talk about that in a minute. But if you're staying at a nearby hotel or Airbnb or any one of these locations, it would be nice for maybe the first 48 hours to have a nurse with you the whole time. Now, that just depends on your surgery, right? So if you're having a mommy makeover surgery, that's a much more intense operation. We're doing breasts, we're doing abdomen, we're doing lipo. So you're going to need a little bit more help. But, if you just had a breast augmentation or a breast lift, you don't need to have a nurse for 48, 72 hours necessarily. The first night is always nice, just to, not be alone and have, somebody with you. And on that point, it's very important that whoever you decide to help you, whoever's going to come pick you up when the surgery is done, that person has to sign for you legally that they're going to be taking care of you, and we release the care to that person. So it's important that you pick a responsible human being who's going to be by your side, and that's going to help you throughout the process. Now, for me, the third option, lowest on the list, would be a recovery home. The recovery homes in Miami, I will tell you, are very hit or miss. Okay, we have a couple of them that provide I think a relatively good experience, and then we've heard horror stories about many of them, and I just want everybody to be very careful. If you find yourself in the need to go to a recovery home after surgery, please plan ahead. Visit the recovery home before the surgery. Go by, take a look. Look at the conditions, look at the hygiene, look at the sterility of the environment. A lot of these recovery homes are not in such great neighborhoods in Miami, in random areas. And just so everybody knows, this recovery home business is not really a legal business in Miami or in Florida. Okay, they're not technically authorized to be providing any kind of medical care. So a lot of them put themselves out to be as like Airbnbs type situation, and then you basically find yourself being taken care of by a cleaning lady who's basically feeding you and then kind of helping you get in the shower. But they cannot provide any medical care because why? Because they're not nurses, they're not doctors, they're not medical assistants. And so just be very careful. And if you're not sure, we're happy to talk to you about it and see if we've heard of this recovery house in the past and what kind of experiences we've had with them. But we have had our fair share of experiences with many of them. And it's not to say that all of them are horrible, but do your research. And I think, importantly, go look before you commit. Because you want to see where you're sleeping, how many people are sleeping in one room, how many patients that they're recovering in one location. So that's very important.
I think a pro tip, and maybe your opinion too, is if you're having surgery, you're out of town, out of state, out of the country, and let's say that you're not as flexible in staying in Miami, but you meet your 5-day requirement, is have someone available in your hometown where you're living as your provider that could possibly give you post-op care if needed for stitches. Seromas can happen. We have videos on that. Basically, someone that's able to take care of you. Consider cost because you may have to come back to Miami. Dr. Z is always willing to see you. And basically, what are your thoughts on that?
Seromas are basically accumulations of liquid that sometimes happen after different surgeries. It could be a facelift. It could be a tummy tuck. It could be any type of plastic surgery. And so you have to always be ready that you may have to come back to see me. And it's not the end of the world, but you just want to prepare yourself mentally and financially in case you need to book a flight at any time in maybe the first 6 months that you're recovering. And just like Jasmine said, it could be maybe you don't have anybody that can take a stitch out for you and you're just very terrified about that and you want us to take it out, or a drain, or you do get a seroma and then we need to drain it for you. And so all of these little items, you just kind of need to be prepared that they could come up in the recovery process. The other important topic about the recovery process is all the modalities that are available now. And I know that the nurses are getting a lot of questions about these, and this is part of the inspiration on why we're creating this new brand and launching it at the beginning of 2024. And it's to really be able to provide the hyperbaric oxygen, the IV fluid therapy for the recoveries, the massages in one location. Right now, we basically outsource our massages to different massage therapists throughout Miami. But we want to have everything in-house because we want to provide the best experience for all of our patients and have control over the whole process so that we can guarantee that things are being done safely. A lot of things that come up with the massage therapist, and Ali brought this up before we got on the podcast, was the topic of opening wounds from liposuction after the procedure when doing massages. So that is illegal, by the way. If a massage therapist tries to open your wound after a lipo procedure, that is not allowed. That is going above their training. Okay, the massage therapists are not allowed to manipulate wounds. Not even a medical assistant is allowed to manipulate a wound. And nurses are allowed to do those things under the supervision of a physician. Okay, so we've had some infections happen because of manipulation of these wounds after liposuction, because they want to drain the liquid out when they squeeze the tissue, and we understand the concept, but it's not necessary. The body will absorb that tissue. That fluid, and you don't want to risk a really bad infection because these facilities that you get massages at are not necessarily medical grade, and they're not necessarily using autoclaves to sterilize their equipment, and there could be some lingering bacteria on these massage tables where you can get some pretty bad stuff there and end up on antibiotics in the hospital sometimes. So just be very careful and always talk to us. Always communicate with us. Our nurses are getting emails all day long. They're getting text messages all day, phone calls, voicemails. So we're very responsive in answering questions. Is there something else we want to talk about recovery?
I think to go back on the seroma discussion, I will repeat again, don't rush your recovery.
Yeah.
I think a lot of patients are intimidated by the drain situation. So they try to remove the drain like the second it's ready to be removed. Or sometimes they even like don't show us proof that it's ready to be removed just for the sake of, hey, I want this out of my body. But you have to understand that although it may be tedious, it may be uncomfortable, you may not be too comfortable with blood or fluid or whatever it may be. We put it in like for a reason. So don't rush it, because then you will increase your chances of getting a seroma, and we don't want that for you. So it may be like a little bit of a challenge or something you have to get used to, but it's in there for a reason. So please don't rush it. Just pay attention to your body, pay attention to your output, and listen to our instructions.
Yeah, we give you a sheet that's called a drain sheet, and we make it so easy for you. I mean, we put the times on there for you, the right drain, the left drain, whatever, and you just need to fill it out as you empty it, every 4 to 6 hours. So it's super simple. But the drains are your friends, okay? And I always repeat this to everybody. Drains are your friends. They're there to get the liquid that doesn't belong there. They're there to get it out so that you can recover faster and you can be less swollen, and on top of everything, so that you don't get a seroma as much as possible. So just remember, in totality, seromas can happen in about 15 to 20% of plastic surgery patients, regardless of the procedure. So 15 to 20% of patients are going to get a seroma, no matter what we do, even when we use drains. And so important to not rush your recovery. Take your time and let those drains do what they need to do before you start pulling them out.
Yeah, we're here to take out your drains. The nurses are available Monday through Friday along with Dr. Z. So once that drain does have the adequate output, which we teach you about, we'll go ahead and remove it for you. Again, if that's something that you don't anticipate being able to come to the office for, we have videos on YouTube of Dr. Z teaching you how to remove it on an actual patient. So we have so many resources. Definitely take advantage to take a look at them.
Yeah, and then just be aware of the nutritional component. We haven't really touched upon nutrition, but we are always recommending a product called ProStat. And ProStat, again, available on Amazon. Everything that we recommend is easy access. It ships to your house. Does it taste amazing? I don't know any protein shake or any protein bar that tastes amazing. But you can kind of chill it a little bit, get it a little cold. You're only going to be taking about 30 milliliters. It's a very small, like medicine cup shot of it, but it is high protein content in it. And it's great for wound healing, surgical preparation, post-operative recovery, because most of us Americans, our diet is not great. And so you just need to really supplement with protein and electrolytes. And, there's a product that I have no relation to, but I'm a firm believer in, and it's called LM as in Mary, N as in Nancy, T as in Tom, LMNT. And they come in these packets, again, on Amazon. And you can order them, and they are electrolyte packets that are phenomenal, okay? I basically replaced my morning coffee with Element, and it's amazing. The energy levels are different. There's no fogginess. It's a great balanced electrolyte supplementation, and I really recommend you start using it before surgery and after surgery. It's totally safe. It's not going to affect your surgical procedure at all. It doesn't increase any bleeding. It doesn't have any side effects, but it's really good. And of course, adequate volume with water is super important to get the proper hydration that you need, and then the balanced meals are important. But for wound healing, the two most important scientifically studied, documented items are going to be protein and vitamin C. Okay, so you should be consuming 1,000 milligrams of vitamin C every day for about 30 days after your surgical procedure, and I would even start about 30 days before, just because you want to prep yourself and optimize yourself. And this is why a lot of people are doing IV vitamins, because the absorption of the vitamins through the vein is way more potent than when you're absorbing it through your stomach, because of the stomach acids that break it down. So it's not the same absorption. So again, remember, IVs are your friends, just like drains are your friends. And yeah, there's a little discomfort associated with both of those, but they are worth it in the end.
I think nutrition is like a huge thing to talk about. During your post-op, or we have experienced this a lot, that patients come in and they are not eating after surgery. It may be uncomfortable and you may be a little bit nauseous, but it is so important for your body to get the nutrients it needs to recover. Your chances of feeling lightheaded, dizzy, just weaker in general are so much higher if you come in to see us and you have had like nothing but Gatorade in your system for the past 48 hours. So please, it may be a little bit like uncomfortable, but like nourish your body. You need the protein. So just get it in there somehow, even if it's the Ensure protein shake, whatever it is, you want to take care of yourself when it comes to like nurturing your body.
Yeah, Ensure is a great product as well. We really believe in Ensure. Boost is another example. They're pretty complete supplements that you can take if you're not really being able to physically eat, solid food. It's a good source of liquid nutrition. And so that's a good point that Ali brings up. We have a lot of patients that come dehydrated 2 days later, and they're struggling, and I know they'd be a lot better. Pedialyte, also, let's not forget Pedialyte. We spoke about Gatorade, but Pedialyte is an excellent electrolyte product that you can use as well, and it's super safe. We've been using it in kids forever, but we use it for adults as well.
Our preparing for surgery instructions are really detailed. Dr. Z has continuously edited it. So we have the iron regimen that includes the vitamin C, the folic acid, Hemaplex or Floridix. I noticed that patients that are the most compliant with the iron regimen and Prostat tend to do the best after surgery. Have your caretaker kind of help you with eating, maybe sometimes even planning ahead of time, soups, broths, things that you may not necessarily be able to cook. So you'll meal prep it. Those patients tend to do a lot better. It makes a difference.
I think the name of the game, everything that we've spoken about, is preparation. So you really got to prepare yourself physically, mentally, emotionally. I tell a lot of our patients are super anxious at the time of surgery, right? They show up that morning, they're like, emotional. Some of them are crying. Some of them are smiling. Some of them are laughing. Some of them don't know what to do with themselves. But meditation is super important. Okay, so you should be in some sort of meditative practice, even if you're not having surgery. But you should consider at least 30 minutes to an hour, if you can, of meditation, of thinking about things outside of surgery, of your upcoming procedure, and just kind of focusing yourself and relaxing yourself, because we have a saying in surgery, and this comes from the anesthesiologists, that say when you're going to go to sleep under anesthesia, the way in which you go to sleep, or the thoughts that you have when you go to sleep, are going to be the same thoughts when you wake up. So if you're going under anesthesia and you're a crying mess and you're totally anxious and you're fearing for everything, you're going to wake up with that same emotional state. And that's not good. We don't want you coming out of an operation crying or hysterical or just like emotionally all over the place. We want you to be relaxed. We want you to be calm. We want you to be confident. So confidence comes through education. Confidence comes through knowledge and experience. And so we're here to partake in that process with you, educate you, give you as much knowledge that you need, so that at the time of the surgery, when you're going to have your anesthetic, you're calm, you're relaxed, and you're confident in the whole team, and everybody's going to be there the whole time to support you through that process. All right. Anything else?
No, just positive thoughts.
Yes.
Positive thoughts brings positive energy.
Exactly.
So.
Yes.
On that note.
The patients that have the best results, in our opinion, are the ones that come in with the best attitude.
Yeah.
Most positive, most relaxed, most confident, and trusting. You have to trust us in order for this to work. Because if not, it becomes a very difficult dynamic for all of us. And so we want everybody just to be good. All right. Well, thank you for listening to this edition of the Beyond the Blade podcast. I think this was very instructional, and we hope to bring you another one very soon. Thank you.